Hello, everyone. Welcome to the webinar. Thank you for joining us today. My name is Jesse Lehman. I'm the founder of Kerrier, and we make the Kerrier absorbable bead kit for infection cases. Word has been spreading, and Kerrier beads are now being used for infection management for a wide variety of cases all over the world. Surgeons are using the beads to deliver a high concentration of antibiotic locally to sites where infection is present or anticipated. Calcium sulfate in the kit is surgical grade and fully absorbable, unlike bone cement. And the sterile kit is easy to use and it's affordable. We've been receiving a lot of inquiries about Kerrier bead use for rabbit abscess cases. So we're excited to have Dr. Michael Weiss with the 2nd Street Animal Hospital in Philadelphia with us today to share some of his experience with the kit for this treatment. At the end of Dr. Weiss's presentation, we'll answer questions, so please send them in through the Q&A box. This webinar will also be recorded and made available at Kerrier.com. So let's get started. I'll pass it over to Dr. Weiss.
All right, hello everybody. Thanks for attending this. This is a clinician approach type of webinar. It's pretty much anecdotal, but I think it's really evidence-based based on the results. And I've been using the calcium sulfate product for probably about 2 years now. I've started using it more regularly in my cases just because there's more use for the product and just the overall success rate. So just a little history of this. So there was an article that reviewed the use of antibiotic impregnated beads in applications of vascular surgery in 2020. And there was over 6,900 papers that were found. And they noted that the publications increased in frequency from 1978 to 2020. And the most common formulation was the polymethyl methacrylate, which we're all aware of, the bone cement. But they did note that in publications on biodegradable formulations, including calcium sulfate, were starting to be published with increased frequency. Most of the publications that were using the antibiotic impregnated beads had very positive conclusions, over 94%. And many of these human studies actually use rabbits as models, which is really good for us, especially with, dealing with so many problems with rabbits. So it all started around 1970. They were using penicillin, erythromycin, and gentamicin. They were incorporating it into the bone cement that was used to attach the total hip joint prostheses in people to prevent infection. They noted that the antibiotics would diffuse into surrounding tissues over several months and really provided prolonged concentrations of local antibiotic at the prosthesis site. And this generated some increased interest in developing and applying the antibiotic bead cement or the antibiotic cement for osteomyelitis treatments. So in 1979, they didn't want to deposit such large amounts of the antibiotic impregnated bone cement to the chronic osteomyelitis sites. So they took the material and started forming these beads, basically. Many of them had like a sterilizable fiber connecting the beads so they could then remove them. And they wanted to do this because they could feel they could pack more of these beads to temporarily fill the dead space created after they debride all the infected bone. And they reported over a 91% cure rate. So all the beads that were being used at the time, the majority of them, were the antibiotic impregnated PMMA beads, which was a polymethyl methacrylate base. So they mixed the antibiotic with a copolymer powder before adding it to a liquid monomer. And anybody that's done this and used this can appreciate what the statements I'm about to make. The cement hardens very quickly. So once you make the mixture, you have to place it in a syringe. The syringe type based upon the size of the beads you want. You basically squirt it out onto a sterile plastic or a metal surface. We use surgical drapes. And then you have to quickly cut the tube of cement into small pieces to create a group of small cylinders that would then function as beads. And then we would basically store these in sterile syringe cases for future use. So the problem with the PMMA beads, really have a short time frame to make the beads when they're mixed. Very annoying fumes when you're mixing them. They don't dissolve, they're messy, and you have to take them out, or you should take them out. And they've also noted, they demonstrated that there was really a short period of antibiotic release. So there was a decrease in local concentration of the antibiotic that they used to 10% of the initial levels within 24 hours. And the other thing with these beads is they did not provide a scaffolding or an environment for bone regrowth. So after the beads were removed, in many cases, it required autogenous bone grafting. So there are so many drawbacks to the PMMA beads once you start using the calcium sulfate. And really, there's no need for bone cement anymore. It's just not practical in practice. And the calcium sulfate is just really an amazing product. So the antibiotic impregnated calcium sulfate releases 100% of the antibiotic load versus the polymethyl merthiolate. Very easy to prepare. In cases I've done, I've noticed that the pellets will dissolve in 4 to 8 weeks. I think variations may be based upon the antibiotic that you're using, because there just doesn't seem to be really consistent. There's no fumes. You can store it in a sterile container for about 90 days. Again, we use syringe cases. There are superior elution characteristics, and there are studies for various antibiotics. There's also a higher sustained antibiotic concentration over a period of several weeks compared to the PMMA beads. And these concentrations locally are many times higher than the MIC concentration for the relevant pathogen that you've cultured. And the really cool thing is it actually provides a scaffolding type environment for bone regrowth, which is really important in the small mammals that have so much destruction of their mandibles. So in vivo, they noted that the calcium sulfate was resorbed, resulted in increased material porosity, which allowed for bony ingrowth. So the implants remained stable, and they provided compressive strength throughout the bony ingrowth process. And using micro CT imaging, they demonstrated guided bone formation within and surrounding the composite pellet or bead. So this results really in rapid restoration of bone, which is really really integral to the clinical management of dead space setting of osteomyelitis. And this is extremely important when we're dealing with mandibular abscesses in rabbits and other small mammals where there's so much bone destruction in the dental arcade and just the mandible itself. So the Kerrier calcium sulfate bead kit is really extremely easy to use compared to the bone cement. So it comes with a mixing bowl, a mixing solution, the calcium sulfate powder, this bead mold mat, which you can produce either 5mm or 3mm beads. Depending what antibiotic you use, there's 4 different mixing instructions, and they're all just slightly different. And it really depends upon the setting time of the different antibiotics. So, and whether they're powder or liquid. And you get a set time chart. I know there's a lot of detail here, but it shows you the setting time of the different antibiotics. I recently used chloramphenicol base, since we use that a lot in small mammals, and it's set in 15 minutes, whether you're using 500 milligrams or a gram of powder. And amikacin is a real good one. 500 milligrams takes 50 minutes to set. If you use a gram, it's going to take you 4 hours to set. So that's something you really need to know going into a procedure when you want to make these. Sometimes in some of these cases, we've put the animal, set them up for anesthesia, pre-med them, and while he's pre-medded and waiting to be induced, I make beads. So then they're just ready to go right away, fresh. So it's really important to get culture and sensitivities on these, so you're using the right product. The one thing I have to say is anybody that's dealt with these abscesses knows that sometimes you don't get any growth. So in that case, I probably recommend using Amicase, and that seems to be sensitive to everything. So this is a recent case that we did. Coco, the 2-year-old Holland Lop rabbit that had recurring mandibular abscesses. He had gone to another veterinarian, did a very good job with this rabbit. The client just kind of got a little upset that these abscesses keep on coming back, which they usually do. So in 6/21 of 2021, it was presented for a draining mandibular abscess of the left cranial mandible. He had severe dental disease. His left mandibular incisor 301 was associated with the abscess, and it was scheduled for dental and abscess surgery. And in the meantime, was started on enrofloxacin and meloxicam. A couple of days later, presented for the surgery. The left mandibular incisor was removed. The fistula, after the tooth was removed, was explored. The abscess was opened up, and they basically sourced the abscess at the apex of 301. So then the abscess was cleaned out, irrigated, and a gentamicin impregnated gauze implant was placed in the capsule. The capsule was closed, a culture sensitivity was obtained, and they had no growth out of that culture. I don't know the source, if it was the abscess, the material, or part of the joint capsule. I don't know what was sent. So 8/21, which was a couple of months later, the abscess was resolved, and they scheduled the gauze to be removed. A month later, and apparently the client probably was a client compliance issue here, not coming back in time, the abscess recurred. Came in, there was another fistula, abscess was explored, a lot of debris was removed. There was no evidence of the gauze implant. The abscess was irrigated, edges freshened and closed, and sent home on enrofloxacin again. 2 months later, it returned. The abscess had recurred. There was purulent material in the oral cavity, and they did a CT scan. There was also significant mobility now of the left mandibular second premolar, and there was discharge around the base. Anybody that's done these and squeezes the abscess on the jaw, sometimes you see a mouthful of pus and it coming up from around one of the teeth. So the abscess was lanced, drained, irrigated, marsupialized the capsule this time, and they did another culture sensitivity and came up with a highly resistant Pseudomonas, but it was sensitive to amikacin. This is a CT report. I'm not going to get much into this. Basically, this is just a train wreck of a mouth. There was bone destruction, lysis. There's the periodontal spaces were widening, just a real mess. So, and I think CTs are really critical in doing this. And I think if you do have a practice with rabbits and you have a CT, you probably should be doing CTs as often as you can on these cases. So we saw it on January 8th for a second opinion. And again, with chronic mandibular osteomyelitis with abscessation in the surrounding soft tissues, you can see some bone destruction here. This is all abscess material here. So we lanced the abscess, drained it, flushed it with dilute betadine solution, and started on Pen G injections every 7 days. And we graded the overall dental disease using reference lines, graded 3 out of 4. And we always recommend using these reference lines for giving the client a long-term prognosis in cases of small mammal dental disease. They expect cures, and when you have a grade 3 or even a grade 4, it's going to be a chronic problem, and they need to know that. This is a really good reference. Want to maybe copy the article down or pick it up once this is recorded. It's really the interpretation and the grading of dental disease in rabbits, guinea pigs, and chinchillas where we see most of the problems. And it just utilizes these guidelines. And from these guidelines, this is a normal case. You'll be able to grade 1 through 4 dental disease. And it's just really a good thing to be able to tell a client and then, what the prognosis is down the line. So on January 21st, we made an incision through the abscess. You want to really get really good exposure here so you can debride as much affected tissue as possible, including any capsular tissue, bone, any teeth that you can see that you have to remove. You really want to try and clean up the best you can. Then we close the incision approximately 80%. So we use the 2-layer closure. We use PDS in a simple continuous pattern, just didn't close it all the way, left about 20% open. So we could then pack the dead space with the amikacin impregnated beads that we made about a half an hour before the procedure. Or probably a little bit longer than that, took a little bit longer to cure. So we use pretty much the 5mm beads, but we did also do 3mm, only just to try and get the area as packed as possible. You don't want to overpack it, make it too tight. You kind of want these beads to breathe so they can give off their antibiotics and dissolve. So this was 2.5, a recheck. You can see the beads are starting to dissolve. What I thought was interesting was this capsule that seemed to be forming around the beads, and when on a physical exam, it seemed kind of soft. It's really tempting to kind of lance it, figuring there was more material in there, but we didn't. I think this is just a reaction to the beads. It was just forming a capsule, just trying to wall everything off. It would have been interesting to open that up, but it's a client, and they kind of had it with surgery, and we kind of want to see how this would progress. So then we did another radiograph 2 months later. You can see the beads are still dissolving. There seems to be some resolution of the osteomyelitis here. And then 3 months, the beads are gone. And the one thing we noticed that there seems to be pretty straight line here on the mandible. So there's definitely bone regrowth. And we're left with this kind of focal opacity here, which we felt was just probably still some of the material disintegrating. And then at 9/12, almost 9 months later, another radiograph, and the osteomyelitis was resolved. This inactive radiopaque encapsulated area remained, which I am assuming it's just the rest of that capsule. It just has some calcium sulfate material in there that's probably going to be there for a while. So you can see how bad the bone was being destroyed and how you have regrowth of bone. And this is really typical with this calcium sulfate, because as it's dissolving, you have this increased porosity of the material that actually allows bony ingrowth into the material. So conclusions, and this is the map, by the way. So once you put all the material in here, all you got to do is turn it upside down and manipulate it a little bit, and the beads fall right out. So it's demonstrated great promise in treatment and resolution of abscesses in small mammals. It has the ability to remodel bone with a mandibular osteomyelitis, so that's a tremendous benefit when dealing with rabbits. There's no need to remove them. They dissolve in 4 to 8 weeks. And we have had a few cases where we had to go back in with a second treatment after they've been dissolved, and it just seems like it's not getting much better. So we've had, I think, 2 cases where we actually had to do 2 rounds of the beads, and then it resolved. And they're so easy to prepare and store. So in rabbits, we do recommend the concurrent use of Pen-G injections. We use 50,000 units sub-Q once a week for a month after radiographic and physical exam resolution of abscesses. So the question I've been asked is, well, how do you know that, if you just use the beads, it would have resolved it, and maybe the Pen-G really, kind of the combination of the two is really what cured it. But we've done some of this without Pen-G. It's just something I've been doing for years with abscesses and jaws of rabbits, giving Pen-G. So I think it's just a habit of mine. But we have had resolution without doing that. And we do also in guinea pigs, we don't use Pen-G. And we've used these beads in guinea pigs with resolution of the abscesses. It's very important to do a culture sensitivity before starting the antibiotics, so you know what to use, and make sure you culture the capsular tissue. If you just culture the toothpaste that's in there, you're probably not going to get any growth. So just make sure you grab some of the capsular tissue and send that off. And it's very important, no matter what you're treating, that you debride as much infective tissue, bone, teeth as possible to really give these beads a chance to work. Again, make sure you fill the entire dead space. Let the beads breathe. I recommend you have a 2-kit inventory. Sometimes these abscesses are so big, you'll use up one complete pack of beads, and you'll need more to pack that dead space. We recommend keeping in stock amikacin liquid, cephalexin injectable, and also a chloramphenicol base, which I think Jesse has a pharmacy that will send you vials, 500 milligram or 1 gram vials of sterile chloramphenicol base powder. So you want to consider using this in all infected wounds in small mammals and in birds where complete surgical debridement is not possible. Mandibular abscesses, we've been referred some scrotal abscesses, people that are neutering guinea pigs and not doing the abdominal approach, and they're just rubbing their scrotum on the ground and they get infected. These are pretty hard to really clean everything out. So we've been cleaning the best we can and packing them with antibiotics, and they resolve. Also, amputation sites, fracture repair sites, pododermatitis, or any procedures if you're concerned about the possibility of an infection down the road. I have not used personally in reptiles yet, but it has been reported. I believe Jesse told me that they're using this in sea turtles. I'm assuming that's down in Marathon. But it's also good if you're dealing with a reptile that where administration of systemic antibiotics may be difficult. So I just like to thank Jesse for this product. It's a great product and allowing me to give you some information on it. As you can see, I'm kind of a Phillies fan. I was at the World Series game Sunday. I can tell you that was a great experience, and just hopefully we bring the World Series back to Philadelphia. So I'm set for any questions. All right.
Any questions out there? Thank you, Dr. Weiss.
Sure.
For an excellent presentation. We really appreciate you.
Yeah, and I encourage everybody, if you're dealing with these, get a kit, you know, and it's, I think we, I'm not sure, I don't remember what your charge is, but we charge $300 for the beads. You know, we charge them no matter how many we use, we charge $300, plus the cost of the antibiotic and the surgical procedure. And you know, I think most people are so frustrated with this that they do go for it. We've had no problem selling the procedure to clients, especially how well these things resolve.
Yeah, cost per kit is $185. Orders can be placed online at Kerrier.com. They ship same day. They, you know, and you can choose how you want them shipped, ground, expedited. And they're shipping now with a little over 2 years shelf life on the sterility. So yes, keep a couple on the shelf, they'll last.
Great.
We do have a question that has come through. Let me see from, let's see, do you do a surgery to get the capsule sample for culture prior to a larger surgery to remove the abscess?
Yeah, we, what we'll do is we always initially, when we see these cases, you know, these animals are not feeling very well. So we do sedate them. We do lance the abscess, drain it, flush it. Usually we'll just send them home on chloramphenicol. But when we do that, we do snip a piece of the capsule and send that out. So then once we get the culture back is when we schedule the surgery. But that's important, yeah.
Any other questions out there?
Yeah, so my recommendation, get a kit, next case, go for it. You know, it's so easy to make. It's really easy to do.
And please feel free to call me at the number on your screen anytime, call, email. I'm happy to help and walk you through it and answer any questions. So please don't hesitate. And visit Kerrier.com. There's a lot of information on the website. There's other webinars, supporting research. It's a great resource.
Yeah, if anybody here goes to the Exoticon conference, there are some of the big players that are using the beads, doing some investigations on it. Good friends of mine that are speakers there probably will presenting some of these cases at the next Exoticon. But yeah, it's really being looked into. So
we got another question. Can you use this for a deep bite in a snake?
Yes, I have not, but yes, you could. And that's one of the good things, especially if you have a client that it's going to be really hard to administer medications. You basically can, and we've seen a lot of these deep wounds, when people feed live prey. You can definitely pack that area with these beads, and you just have to cover it up. You can even have an open wound, just apply it to the open wound and just make sure you really cover it up with some Tegaderm or something, and then a good dressing. But yeah, it's really unlimited how you can use these. And the nice thing is once you make them, we have them in sterile, the sterile syringe cases. We just mark on the syringe cases what antibiotic we have in there. And then you can basically just grab one of those syringe cases and you have the pellets right there ready to use. I think Jesse said there was an anaconda with a real severe osteomyelitis, I think, of the jaw that they use this stuff in.
Dr. Weiss, there's been such a wide array. I mean, a turkey last week, and I even a shark. I even got. I heard when somebody called me on. But I mean, there's infections are everywhere. They're not going to go away. They're very challenging, and this is a tool. This is a big tool in your tool chest.
And it's safe, and that's the thing. Especially in exotics, there's a lot of anecdotal stuff. And, the first thing is do no harm. And you're not going to do any harm doing this. I mean, at all. So it's that, and that's the good thing. There's really no risk to the animal at all.
The dose is usually, less than a daily dose, and it's all local and it's slow release.
Right.
So, you won't find, any studies out there where there's any toxicity issues. So
right.
It is safe.
Yep.
Yeah. Any other questions? Right here, we did. Okay, so there was another question. Do you have pre-made beads and various antibiotic impregnations? Yeah, go ahead.
Yeah, we do. In most cases, in cases where we don't use all the beads, like when we make a pack of beads up, what we'll do, we'll have the plastic syringes and, put some gloves on, pop the top off, dump the syringe out, like 6cc syringes. And then we'll put some of the beads we make in there and then just seal it with some autoclave tape. And then on that, we write what antibiotic it is. So then we basically, we usually have some left over. So that's why we like to make multiple sterile containers. So we do have some left over if we need some. So yeah, definitely can.
There is a study, the veterinary college is doing a study on that sterile prep, using sterile technique, placing in sterile containers. They actually put it on the shelf for a year, and that data is going to come out soon as well. So that is a good way. But if you can plan it out, like Dr. Weiss was saying, and prep out a little sterile area, or use the same back table you're going to be working on, and make them beforehand. It's just a little planning before, and they'll be ready for you.
Yeah, and the one thing we haven't used yet that we're looking forward to doing in the summer is this Cuterebra in these rabbits, outdoor rabbits. You pull those big maggots out of there, and you got this big hole. And they're a little difficult to treat. And, some people surgery will remove them. I think just packing those defects made by the cutorebral larva with beads and then just suturing it shut, I think will be a really quick resolution of those.
Any other questions? That's it, Dr. Weiss.
Very good. And, also besides contacting you, Jesse, they can contact me also, Second Street Animal Hospital in Philadelphia. I'd be more than happy to, if they have any questions when they're getting ready to use it, to help them out.
Excellent. Appreciate that.
Okay.
All right, great. Thanks, everybody.
Great. Thanks, everybody.
Have a great night.
You too.